Hi, my name is Jennifer Stasieluk. And did you know, according to the CDC, there's about 722,000 reported cases of hospital-acquired infections every single year. And this statistic was posted in January of this year, 2018, so that accounted for last year, because every year they come out with like a new statistic. And so that's about 1 in 25 patients, and that's not including the general just public, because not everybody goes to the doctor to get infections treated, so this is just in hospitals. I'm talking about like hospital patients. So what I want to talk to you about today is how we can prevent the spread of infection. And one very simple thing is through hand hygiene. And I think I'm a good person to talk about this because I'm in nursing school, so they drill it into your head since day one. I work in a hospital, so through my CNA program and through working through the hospital, they train and retrain you. And then I also live with my mom, her immune system is suppressed, so she doesn't have a very good immune system. So we are very hygienic and like to keep everything clean, including our hands at home. So today I'm going to talk to you about the history of hand hygiene, that it wasn't always what it is today, the different types of methods of keeping your hands clean, and how to properly wash your hands. So first, hand hygiene was not always as prominent as it was today. In 1846, in the 1840s, doctors didn't even wash their hands in between seeing patients. They didn't really believe in washing their hands. It just wasn't a thing. Until 1846, when a Hungarian doctor named Ignaz Semmelweis was the first person to kind of discover hand hygiene, because he realized he actually would deliver babies and the maternal and child mortality rate was so high. And then he also observed at the same time that medical students and doctors would not wash their hands in between procedures. So they would go to do an autopsy on someone that had been deceased, and then they would go treat a patient or deliver a baby or something. So infection spread was huge. So once he kind of discovered, and he washed his hands with chlorine, which we don't do that today, but it was at least some method of getting the germs off his hands, and he tried to spread the word, and it actually did not take too well at first. Doctors they took it as offensive, as if like, oh, I'm the one causing infections, so they actually kind of shut him out. But then later it kind of came back, and he was able to spread, and the death rates dramatically dropped. I wasn't able to find a statistic on it, but yeah, so then in 1995 to 1996, the CDC and the Hospital Infection Control Practices Advisory Committee, they published that using antimicrobial hand soap or a waterless antiseptic like hand sanitizer is actually okay to use in between patients and to kind of keep things clean. And then they actually came out with like a standard of care, like a guideline that actually hospitals, now it went through different organizations, that they actually look for when they come in. They rate and they analyze the hospitals and their practices. They look at kind of stealth, like, are the nurses and doctors using hand sanitizer on their way out and in between patients, and are they constantly washing their hands? So even though, there's a couple different ways that you can keep your hands clean, and it's by using either antimicrobial soap or a waterless antiseptic like hand sanitizer. Soap, it's kind of 2-in-1, where the friction of actually washing your hands and the soap is going to kill the germs, and you want to use this when your hands are actually visibly soiled, so that's not even just in hospitals, but if you're cooking and all that, and then when you're around someone that has what they call a multi-drug resistant organism, so MRSA, C. diff, ESBL, those types of things. And then hand sanitizer is really good for even places that don't have running water, or If just in public, you're in contact with another person, if someone's sick, just kind of a quick way, you can keep it in your purse or your pocket and kind of clean your hands in between. And then it's really good to make sure that it's alcohol based, because then you know you're actually killing a lot of the germs. So a little how-to, because even though people kind of make the effort to wash their hands or try to keep their hands clean, a lot of times they're not doing it properly. So with soap, you want to use warm water. Make sure you get under your fingernails, in between your fingers for about 20 seconds, and then use either a disposable paper towel or a clean towel to wash your hands, not the one that's been in your bathroom for 3 weeks without washing it, because that just has germs on it as it is. And then the hand sanitizer, you want to rub it on your hands thoroughly, your wrists, fingertips, everything, and don't wipe it off. Just let them air dry until the alcohol evaporates. And then lastly, people think that it's only doctors and nurses and people in the healthcare field that it's only their responsibility to prevent infections, but it's actually not. It's all of us, because this rate, if everybody was washing their hands properly and stuff, that initial figure of 722,000 reported infections a year would decrease. All right, and then, so like I said, I know that all of us are very busy people, so the last thing we want to do is spend time being sick. So if everybody would just keep their hands clean, try not to put your hands in your mouth and all that, we could greatly reduce the spread of infection. Thank you.